Have a good Thursday, and we will speak to you tomorrow.
All right, I'm excited about all that. We'll talk to you on Friday, okay?
Sounds good. See ya.
All right, see you. Bye. All right, we're going to roll to the other side of the table and see what's going on. Hi, Nancy. How are you?
Good morning, Al. And we're rolling this morning with Sandy Rice. I'm not going to refer to Sandy as a guest because she's just one of us now.
That's right.
She's a regular.
A regular.
And Sandy, I'm so glad Sandy is a retired nurse practitioner, although not fully retired. You're working, aren't you?
I had 2 years. I worked in an Asian restaurant, but now I'm out of retirement to work, volunteer 1 day a week at a free medical clinic in Grundy County.
Right.
Hardest job I've ever had, and the pay is lousy.
Yeah, I bet, yeah. I feel, Sandy, when I think about being with you this morning and the great information that you pass along to us, I feel as though I've come full circle. I started out, the very first meeting that I went to in January of 2013 with regard to the Affordable Care Act was held by Donna Seeley, who was in Tullahoma at that time. She, likewise, was a retired nurse practitioner, and she had volunteered at the Partners in Health free clinic in Tullahoma, and she was, like you are, like all of us can imagine that have compassion, was devastated by what happened to people. She would see it with her own eyes who didn't have insurance, who couldn't get the medical care they needed when they needed it, and of course really bad things happened. And Donna Seeley, for several years there, led groups, informative groups, telling people about the Affordable Care Act. It's very complicated, of course, and when you throw Medicaid in the mix, it further complicates it. So I'll always be grateful to Donna Seeley and what she did. And I'm so grateful to have you here this morning because hands-on people, one of the things we want to do is, I guess, sort of refute or shed some light on and put some true facts out there with regard to Medicaid expansion from our view. And Sandy comes to us with hands-on. She's there on the front. She deals with people who don't have health insurance. I try to deal with people, helping them get signed up. In fact, I had a call last night from a person needing information on how to get health insurance. So we're going to turn Sandy loose and Sandy, by the way, has attended sessions held by the Tennessee Justice Center. That's one of my favorite places. That's where I got some of my training. They're 503C3 small law firm in Nashville that helps TennCare people, and so we learn a lot from them. But anyway, I want to mention a couple of meetings coming up. On Saturday the 15th, we hold our regular Democratic Party meeting. This Saturday the 15th at 9 o'clock, and we have a headquarters. It's 420 East Main Street in Deckard. So be there, and something, folks, let's be serious about this. If you want to see a change, if you want to see the regular working everyday people, some who don't have insurance, taken care of, and someone mentioned this morning, I was watching a program on TV, that Democrats mostly, we tend to the problems and the issues that everyday people have, that we know and realize how people actually live, and we try to meet those needs. Come to our meetings and get registered to vote, and go vote on, remember these names: Bredesen, Dean, Mariah Phillips running for Dejalay's seat, and Sharon Adams. We need people in our state legislature and in Congress really, really bad right now. I got myself sidetracked. September 29th is our Democratic Party. It's a big fundraiser. It's a barbecue, I believe. Right?
Always barbecue.
Always barbecue.
Or chili.
Yeah, barbecue or chili, yeah. It will be at the large community room in the annex. The tickets are $20. That it is a fundraiser. We need to raise some money to help these good Democrats get into office. I believe Saturday the 20th or the 22nd, I'm going with Betty Fraley to Nashville to a Tennessee Federation of Democratic Party meeting, women's meeting. It's the women's meeting. But anyway, Betty and I'll be doing that. September the 20th, there's a Carl Dean event in Sewanee.
It's at Shenanigans.
Shenanigans, right, yeah.
5, and I think it's 5 or 5:30, and then it's followed by a band, a boy named Banjo.
Oh, yeah,
is going to be playing. There's a cover charge for that. But also on September 18th, there's a fundraiser at Pearls in kind of between Monteagle and Sewanee for Mariah Phillips. And there'll also be on September 27th a fundraiser at Shenanigans. No band, sorry, just free pizza for Mariah.
Yeah, good deal. I ran out this morning, had a packet of notes all together, and ran out and left it at home. So I'm doing some of this from memory and with the help of Sandy. And this is a call-in program. If you want to call us, it's 967-2201. That's it, isn't it, Al? Yes. 967-2201. I bet y'all got that memorized anyway. Sandy, are you ready to go on what you recently attended a session at Tennessee Justice Center, I believe, and got up to date on some things.
That's right.
Okay,
and they
Sandy.
send me stuff all the time.
Go, Sandy.
Okay. Well, I wanted to just kind of give a little summary of the state of the Affordable Care Act, or Obamacare, and then talk about Medicaid expansion, which is a state issue. Okay, so the Affordable Care Act, or Obamacare, first of all, it's a federal program and a law. It's not part of the state legislature, but it gets a lot of negative press. Every problem our medical delivery system has had since 2010, from high deductibles to your child not getting a cherry sucker at the pediatrician's office, is perceived to be the fault of Obamacare. But what the ACA did was insure a lot of people that had never been insured before, and it required that some things be done to make insurance coverage more comprehensive and fair. The law requires insurance policies to provide essential care benefits, not just a limited menu of things, but doctor's visits, emergency rooms, pharmaceuticals, maternity benefits, preventative care. It was also designed to stop the practice of denying coverage for pre-existing conditions, and I'm going to define some of these things in a little bit, just so that we're all on the same page. It allowed a child to remain on a parent's policy until the age of 26. People were required to have insurance, even if they were healthy, no significant health problems, in order to spread the risk and the cost. There were also some limits on what an insurance provider could spend on administrative or advertising or administrative costs. In other words, a big chunk of the money needed to be spent on care. Federal subsidies helped with out-of-pocket expenses. It overall maintained the commercial insurance market, so it wasn't a single-payer system. It was multiple payers. Pre-existing conditions, I'm not always sure if everybody knows exactly what that means. It certainly is something that's thrown around all the time in the news these days. But those are illnesses or conditions that require medical or mental health care at the time you get insurance. So if, say, a person has diabetes or high blood pressure, asthma, arthritis, whatever, you go into a room of people and ask how many people have medical problems, and almost everyone will, or be in denial, or have something brewing they haven't been to the doctor about. So you go to your insurance agency, and they say, fine, we'll give you insurance, but we're not going to cover anything related to your diabetes. So that's probably why you're trying to get insurance, right? So that's when people are denied coverage, or their pre-existing isn't going to be coverage. Okay, the ACA was a big government program, is a big government program that when it was passed as a law did not have broad bipartisan support, even though there were a lot of compromises. It had some major problems with rollout and some flaws that could have been improved. Any big government program, any big program anywhere, needs to be modified. But the Republicans, they just really hated it from the get-go. Trump led the charge to repeal it on day one, if elected. He found out when he was elected that he had to at least ask Congress to repeal a law. But he set about destabilizing or sabotaging the ACA and declaring it dead, which it wasn't and isn't. So Congress couldn't get it repealed or replaced because after a few years, a lot of people told their senators and congressmen not to repeal it because it was helping them and their families. So it wasn't repealed. We did have a replacement plan there for a while, and that wasn't very popular either. It took the ACA a long time to be kind of put together, so it's not something that can kind of be thrown together. But since then, the Trump administration has been eliminating parts of the ACA in ways that have caused really premiums and deductibles to increase. People are becoming uninsured, and health care is really continues to be inaccessible and unaffordable for many working people. Of course, all this is still perceived to be the fault of the ACA. One example of this was the repeal of the individual mandate. This is what required people to have insurance. It was very, very unpopular. People that didn't want to go into the exchanges or be insured had to pay a fee that for some time wasn't even being collected, and in some cases it was waived if you had financial hardship or something like that, maybe religious preferences, I think. But it kind of balanced out the payment. You can't have all sick people in an insurance program or bad drivers because it raises the cost for everyone. But anyway, the individual mandate was repealed, and even Tom Price, who was for a while our Health and Human Services Secretary, said after that was done, it probably wasn't a good idea. It increased prices. Of course, he was forced to resign for spending too much taxpayer money on pens and airplanes and things. Okay, so a couple of things. The days of I just always think when I hear criticism of the ACA that I worked in the days of commercial or free market health insurance before the ACA. Times were not so great for people. The cost of care, health care in America has been increasing for decades. Our insurance coverage has been connected to employment for many, many years, but costs have increased to the point that some smaller employees couldn't afford coverage, and larger companies had to pass on a lot of the increased costs of their employees in the way of higher deductibles and co-pays. They call these out-of-pocket expenses. Our high insurance costs and healthcare costs make goods and services more expensive and less competitive on the world market. Another thing was that insurance companies really kind of sifted through your medical records and decided to deny your coverage for pre-existing conditions, risk factors, or your habits like smoking. Again, the illness or condition you needed insurance to pay for could be disallowed for coverage. And I know there's a lot of stories. There were a lot of stories. A lot of times this pre-existing condition and this investigation by the insurance companies into your records affected women. They because they go to the doctor more often. We have to keep well to take care of everything, right, Nancy?
That's right.
An abnormal mammogram or PAP maybe decades earlier could get you denied for, say, cancer treatment and be called a pre-existing condition, even though there was never a cancer diagnosis before. Medical care within the free market is a big, big business. Lots of people that don't necessarily improve care make lots of money. To today I wanted to be kind of positive, so I didn't bring the list of salaries of some of the insurance CEOs, but they're tens of millions of dollars that they make, and they don't even take a pulse or a blood pressure. They don't contribute anything to health care. Big businesses care about profits and shareholders, not your health outcomes. And billing and administration of private insurance is complex. There's lots of charges, contracts, discounts, and deals. These charges are not transparent. Hospitals, for example, have a whole room full of billing people to get every tissue and aspirin that you may or may not get on that bill. That's a big problem. We don't really know what we're paying for like we do for other services. Very few individuals can afford insurance, on their own. Another thing that's happening right now that's interesting is that 11 attorneys general, including our own here in Tennessee, are trying to eliminate the requirement for insurance coverage of pre-existing conditions. That's the most popular aspect of the ACA, and we've defined that so everyone knows what that is. That will again have a disastrous effect for anyone with an illness. Now, 75% of Americans want the protections for pre-existing illnesses, and 72% don't think that of Americans think that sick people should not be charged more. But our Attorney General is going ahead with this, even though plans are working to increase prices or at least stabilize them in 2019. Another item is short-term health insurance policies. This is what the Trump administration has finally offered. These plans will be cheaper, and so more people will be insured, but you get what you pay for. They'll tend to cover fewer medical services, and I think you're going to need to read the fine print on this. They'll charge higher prices to people with illness if they cover them at all. If the mandate to insure people with conditions and cover their care is repealed, sick people again will have to pay more. And these plans may not cover mental health care or treatment of substance abuse, prescription drugs, and maternity care, sports injuries, injuries incurred while you are intoxicated, possibly hospitalizations that start on the weekend, immunizations, cataracts, hernia repair, acne. They may not cover any of those things. There may also be limits for the year or day, like only so much for each hospital day, or maybe a very small portion of an ambulance transport. There may be waiting periods to begin cancer care. I worked 15 years in oncology, and that's pretty scary. These plans will be heavily marketed, and people selling them will be getting a commission, and a larger portion of what you pay may go to administrative costs and not your care. So if you need or have something that's not covered, you are either out of luck, you pay for it, possibly risking severe financial penalties, or you default and everyone else will eventually pay your part with higher premiums. Just like before the ACA. I imagine that cost care will continue to rise and will fall further behind in having a healthy population. And finally, a proposal for single-payer health care that covers everyone and eliminates huge administrative costs and salaries is probably really decades away. This is Medicare for All, and I've talked about that on this program before. The Republican Party is already hammering away, at it, that it won't work. It'll cost us a lot of money and increase our taxes and that. But just a reminder that Medicare is a single-payer system with low administrative costs for seniors, and they like it. I know people that turn 65 with relief because they don't have to depend on commercial insurance as their primary payer of their health care. Just to mention that candidate for Senate Phil Bredesen and U.S. congressional candidate Mariah Phillips support plans that provide affordable, accessible, quality health care to our citizens. They support single payer, Medicare for all, and to try to save the ACA. Senate candidate Marsha Blackburn has a website, but no position on health care is there. She has been opposed to the ACA during her time in the House of Representatives. current Congressman Desjardins has also fought against the ACA. He is supportive of these short-term health insurance plans, but they're very limited coverage. And during the repeal of discussions, the legislation on repealing the ACA, when I asked Representative Desjardins' office what people did if they couldn't afford insurance, and his office's response to me was that they would be out of luck. Okay, let's turn to some state issues, or the state issue I'm discussing today is Medicaid expansion. Okay, the Republican Party does believe in smaller government and state control of things whenever possible. And so part of the ACA does provide funds to states that adopt a plan so that they can insure more people through their Medicaid programs. We call our Medicaid here in Tennessee 10Care. I just want to go through the difference between Medicare and Medicaid because it's a little confusing, and they're used interchangeably, and they're very different. So bear with me if you already know this portion. Medicare is a federal health insurance program, as I said earlier. The federal government sets standards and pays for portions of services. It's designed to help adults, not children. It serves the elderly and disabled who receive Social Security regardless of income. It's very popular. It's efficient with low administrative costs. People are happy to get it. When we hear about single-payer systems, Medicare is one. Now, we know that the medical care providers for Medicare patients are not government employees, and the hospitals are not owned by the government. So the government is not in your medical care. It's just paying for it. Okay, so Medicaid, think aid. Medicaid, that's a safety net. It's a joint federal and state program. Each state establishes its own standards for eligibility and payments to providers with broad federal guidelines. Costs are shared by both federal and state governments. It serves low-income, pregnant women and children, parents, disabled children, the elderly in nursing homes, as well as physically and mentally disabled adults and women diagnosed with breast or cervical cancer. There are more administrative costs in this program because low income has to be established. The children of qualified families receive medically necessary care, including physician and hospital visits, well child care and treatment, immunizations, dental, vision, and hearing services. Medicaid is the largest program in the United States. About 1.5 million Tennesseans are enrolled in 10Care. It covers 2/3 of long-term care for frail older adults. It covers half of Tennessee's children and half the babies born in Tennessee, and provides major funding for the state's infrastructure for neonatal ICUs. It's also the foundation for rural health, and so supports the infrastructure of rural hospitals. Okay, back to Medicaid expansion. The ACA would provide Medicaid money to states applying for it to cover more people that are uninsured. Now, since 2014, when the Supreme Court determined that it was optional for states to sign up, 33 states have opted to do this, with 3 states pending in it to approve but not implement it. It's interesting that in Maine the people voted to have Medicaid expansion, but the governor won't implement it. He says, I'm not going to do that. Okay, Tennessee is one of only 14, the majority in the South, that we haven't pursued this. In 2014, Representative Jerry Durham proposed and passed, and a law was passed that prohibited Governor Haslam and any governor for expanding Medicaid without the legislature's permission. So it's not us that can decide about this, it's the legislature because of Durham's law. In 2015, Governor Haslam developed a plan called Insure Tennessee to expand Medicaid to 300,000 working Tennesseans that didn't have coverage, so they weren't eligible for Medicaid. It was funded 90% by federal money and 10%. The hospitals were going to pay this through an assessment or tax. There was going to be no new tax for Tennesseans. The governor called a special session to approve the plan, but it was rejected. Despite broad bipartisan support and support by the public, businesses, and the healthcare providers. Now, I wasn't here in 2015, well, maybe just here. There was a lot of backlash about that. That was a very unpopular decision to not bring it up for discussion, and that it wasn't passed. In 2016, there was a task force for expansion with a proposal called 3-Star. It was going to start out with covering veterans and people with behavioral problems. They would get priority for some coverage, but it didn't move forward. And in 2017, the legislature didn't want to return to that because they wanted to see what President Trump, the new president, would do with the repeal of the ACA, which of course didn't happen. At the end of the legislative session in 2018, Governor Haslam feels really bad that this hasn't happened, that we haven't been able to use these funds, tried to bring it up again, but a small group of leaders didn't want to even go there. So we lose about $1.4 billion a year in federal money to be able to provide health care for our uninsured. It's about $3.8 million a day. So that's 5-something billion in 4 years. We have 731,000 Tennesseans who are not insured. 300,000 could be insured with the expansion. This has affected our state negatively. There's jobs forgone, jobs under threat. The expansion could have provided 15,000 new jobs, not just in the healthcare field, but other supportive services. Additional jobs numbering 13,500 have been lost from hospital closures. And you've all heard about our rural hospital closures. They're financially strapped. 6 have closed, and dozens more are at risk. Medicare expanded states are 6 times less likely to have rural hospital closures. 85% of Tennesseans are concerned about this. This has affected our insurance premiums. Okay, when uninsured people require emergency care or hospitalization, some of them unnecessarily because they don't have primary care to kind of keep them out of trouble, and they can't pay. Costs are shifted to everyone with insurance, so we're already paying for everybody. And our opioid crisis is underfunded, and that continues to be a big concern in Tennessee. How great it would be to have more money to combat that crisis. Now, note that our tax dollars are being used to other states. So we pay our federal taxes and income tax and other goods and services, and they're going to other states, okay, to improve the health of their residents, not us. The money's not just sitting in Washington waiting for us to decide to take it, and we don't get any break. We don't get it back in any form. So if we expanded Medicaid, we could create jobs, reduce our insurance premiums, and improve our safety net and healthcare infrastructure, especially in the rural areas. We could treat our addiction crisis and cover 300,000 working Tennesseans, including 24,000 veterans. You know, we've talked on this program before that the VA doesn't cover everything for all veterans.
That's right.
So we're always very concerned about our veterans here in Tennessee, very proud of our veterans and how we have contributed to the armed services. I'm just going to mention this quickly of what our state legislature has done this past year, and that was to pass a work requirement for Medicaid recipients. If they didn't work or do volunteer work for X number of hours, they would lose their benefits. The assumption was that there's a lot of able-bodied people receiving Medicaid benefits, but let's just go back and review who gets Medicaid. Low-income pregnant women, children, disabled children, the mentally ill, the elderly, and women with cancer. So there might be a few in that group that should be working, but the federal government is really reviewing this for all the states that wanted to do that. It's a special concern in the states that have not expanded Medicaid. because even more people would be uninsured and not receiving health care. Our state senator, Janice Bowling, I've talked with her and written her letters for a while there until I got busy with Mariah's campaign. Every time I worked at the clinic, I would tell her a new story, but I didn't get a response from that. She's very much opposed to Medicaid expansion. I believe she has some misinformation about that. Our current county mayor, David Alexander, I think he was a little bit more open, but was still opposed to the expansion, and now he's our current county mayor. Okay, I've left a message and a video with candidate Ira Sweater. She's running for our state representative. I've received no response. I can't locate a website with her position. I know she is endorsed, I guess, by Janice Bowling, so I'm probably assuming she would not be supportive. Candidate Sharon Adams, however, does support Medicaid expansion, and she and I have talked several times. She's received some training from the Tennessee Justice Center. The GOP-controlled state legislature is obviously opposed to Medicaid expansion. Bill Lee, I talked to his office at the primary. My response was that he was supportive of block grants. Now, block grant is a lump sum of money given to the state to administer Medicaid program. Again, Medicaid program to allow states to kind of do that. It was part of the Trump plan that was proposed as a replacement for the ACA. But it was rejected. The block grants were rejected by governors across the country because it was so much less money than they were receiving under the current system, and it's off the table, so no block grants. But Bill Lee's website has very, very little about the issues, so I've called them again to see their response. I think I've seen an ad either by his campaign that he was against it, or it might be from Carl Dean's ads. I'm not watching too much television.
At least Carl Dean's ads are telling us now that they're showing money burning and showing $3.8 million a year.
A day.
Yeah, a day.
Yeah, a day. I know that's hard to get your mind around. But.
And I'll interject right here, Sandy. And I'm remembering some of the information that I had written down and had that I left at home. But Vanderbilt does this poll, I reckon every year, every spring. It's called the spring, and the one they did in 2018 in the spring showed that 66% of the people they polled approve of Medicaid expansion. Health care is right in there. Education, health care, and the economy are just sort of right in there together of concern now to Tennesseans. And another sort of bit of good news I read, and just checking the latest what's going on with affordable health care and premiums, and they're saying that, I saw from more than one source, that in Tennessee, our premiums for 2019 are going to be lower. And one article,
North Carolina's were going down too.
One article said that it had to do with, last year I believe, they went higher. Insurance companies in Tennessee sort of overshot what they needed. So they're backing off now. Our premiums for the affordable health care are going to be lower, of course, as you say. It's under attack by the present administration in Washington, peeling away the coverage. Let's hope somehow it doesn't get that bad, because the pre-existing condition thing is big. That's just it to me. And wanted to point out also with regard to premiums, and of course I hear people complain. I'll see somebody on the street and say, my deductible is so and so and so and so, or on the Affordable Care Act. But last night I went on the healthcare.com website and looked up. Now, this is still for this year because they don't have in the system yet the premiums for next year. So everything's this year. But this year, of course, we don't have an open enrollment period again until November 1st, but some people will fit into a special enrollment period. If you lose coverage, you can get coverage through a special enrollment period. And I talk to people, sometimes older people that are, say, have reached 62 and are drawing Social Security, low income, but don't have Medicare yet, no insurance. And so I put in the computer a 63-year-old man and a 62-year-old woman, man and wife, and at an income of, say, around $24,000 a year for both of them, Blue Cross Blue Shield has a zero premium. And I first saw these zero premiums last year when premiums had gone up, yet Blue Cross Blue Shield had zero premium policies. For instance, they could get now $24,000 combined income, $20 deductible each, and $675 out of pocket. That's good. Now, as the income goes up, all the way up to, I found, over $60,000, they could still get the zero premium coverage, but the deductibles go up. The highest deductible I saw was $2,500 per person, and then the out-of-pocket $5,000. Of course, what that means, though, and they have the preventive care. There's free preventive care on all those marketplace policies, as I understand. Free, that no charge, no matter what policy you have, as you were pointing out. And, of course, what they have, though, is no monthly premium, zero monthly premium, and they got coverage. If they wound up in the hospital, one of them, the most that it would cost them would be $5,000 as opposed to maybe $50,000, $60,000 or hundreds of thousands. And they've got the free preventive coverage.
Now, do they have to? But with the deductible, they have to pay the first $25,000.
No, $2,500. $2,500. That's at the high income level. That's in the 60,000s. If they reach 60,000, that they would have the high deductible. But starting out, the lower income is $20. And so there were lots of people that were low income that needed that were maybe just drawing Social Security, or maybe just one person, just a man or a woman by themselves. And the high deductibles apply to, of course, the higher incomes. The higher the income, it goes up in steps. Something else I read, and I think I got this right in an article I got off the internet just this morning, that in Tennessee, by it's either 2020 or 2022, maybe 2022, we will have lost $22 billion by not expanding Medicaid. And of course, the money is just that's just unimaginable to me. But the thought of one person out here not having insurance just because our legislature is now controlled by the Americans for Prosperity and the people that go by their first allegiance is to ideology and to somebody that's supporting them, or somebody out there that's threatening to primary them if they vote for Medicaid expansion, instead of allegiance to actually individual people, individual voters. Their allegiance is to some other organization out there. And it is so sad, and I don't understand it. I don't understand how they can look at themselves in the mirror, and think of the people you see at your job now that suffer because of no health insurance.
The people that I see are not covered by the ACA, because if they are, they have a doctor. They have the ability to to do that, and
Well, see, of course, that's where we need Medicaid expansion.
right.
When they wrote the ACA, it sort of changes every year, but
this Medicaid expansion was to get those people in the middle that weren't,
the people that
didn't qualify for Medicaid,
right,
didn't have commercial insurance,
if your income,
or employer insurance.
Right, if your income for one person is not expected to be at least 100%, and that's one person. This year it's around $12,000. It changes a little bit every year. But if somebody tells me, first thing I'll ask them, what's your anticipated income this year? Well, I draw $500 a month. You know, that's not going to cut it. But they tell me they draw around $1,000 a month, which is $12,000.
Off you go.
Off you go. Affordable Care Act, one of these good, inexpensive, no premium policies. But otherwise, unless they qualify for a category of Medicaid, if they got a young child at home, a child under 18 that they're taking care of, they can get caretaker relative coverage. If they have women have certain types of cancer, disabled, mentally or physically disabled, but they have to be determined to be disabled. But unless they fall into one of those categories, and there are several categories actually, and children, it's good that children are covered up till 8 to 18 for low income. Unless they fall into one of those categories of qualifying for Medicaid, they're just out of luck income-wise, and that's the gap we talk about. That and Medicaid, when the ACA was written, they assumed the presumption was Medicaid would be expanded by all states to cover those people.
Right.
And of course, when Chief Justice Roberts held that no, you can't force states to expand Medicaid, made it optional, as you said, and that gave free rein then to legislatures like ours to say, no way, Jose, you're just out of luck. And when I think about this and think back to that day in it's 2015, it's January of 2015, when I didn't see any reason. I just knew that committee that considered it would say, oh yeah, Insure Tennessee, Republican governor's program, yeah, they'll do that. You know, and all these people, I had me a list of people that could get insurance. And when that committee voted it down, killed it. And then all over the headlines of the newspaper the next day was this old guy in a big old red shirt bragging about, with Americans for Prosperity, bragging about how they had swooped in, intimidated this committee, and they caused them to kill Insure Tennessee because of course they're supported by the Koch brothers, who hated Obama, and even in the Tennessee legislature, everybody up there seemed to just hate Obamacare, and more than they cared about sick people.
Well, we're going on 2 years.
We're going on,
not the president.
Right. Maybe they're sort of over it. Maybe reckon they could get their minds and some compassion back on sick people. We can only hope, can't we?
I know there's a lot of hostility to low income or vulnerable population. I felt that when I visited the state and talked to our representatives, and against people that don't work, take advantage of the system. But the patients that I have that are uninsured, they work if they're able. They do a lot with the nurseries in Warren County, or they are doing lumber, a lot of care of mentally disabled, physically disabled adults, nursing assistants, or they have children or adults that they're caring for. So I know if you have a child that needs a lot of care and they're 6 or 7, who do you get to take care of them while you go do some volunteer work.
Right.
You know what I mean? You're just not going to do that. You're and factories have closed down, and they can't get another job. They have tried to do a small business. I know that Representative Desjardins had an article in the Chattanooga Times Free Press painting a very rosy picture of our economy. But I think that there's still so many shops and buildings closed in the areas that I drive through in Franklin and Grundy County. So I'm not sure that's benefit. And I also, it's interesting. I'm anxious to have some of my patients that work for Amazon come in, because they're making a lot of money at Amazon. I think from the tax cuts, $1 trillion, I think, profits maybe recently. And I have a patient that lives on fear every day that she doesn't pick or stock her shelves quickly enough. And there is really a bathroom issue. They won't let you go to the bathroom, and they time how long you're in the bathroom. Now, I don't know. This is just what somebody told me. I don't know if it's fake news. I know everybody's real sensitive about that, but this is what a patient, told me. So I don't. And in canvassing, we often ask people how that tax cut's working for them, and it hasn't trickled down to them yet. So anyway, off tangent. But my patients have the main thing is diabetes, just out of control, high blood pressure. We do give medications. We don't have continuity of care. We're only open 2 days a week. We're primarily a volunteer staff, so people get busy. They can't get in. Limited hours. Some real bad diabetic patients. Our incidence of diabetes in this country is on the rise. So if you don't think you're going to be affected by diabetes because you have a good, healthy diet or whatever, you could be wrong. You may still have that. Hypertension used to be called idiopathic, because they're idiopathic meaning no reason. You just have it.
You just have it.
We don't know why.
Yeah.
We have some obesity in our state, and the comorbidities that go with that and injuries. We have lots of people driving country roads, accidents. So we're really at risk for a lot of people being in a lot of trouble, and we don't ignore them. We don't just let them, whatever. They go to the emergency room, and when you don't have any place that you can go, and you have a bad cold, maybe where you kept your finger, or here's one about swelling feet. Your ankles are swollen. I've had more people go to the emergency room because their ankles are swollen because they think that's really bad. It can be a symptom of congestive heart failure, so you've got that heart scare in there too. And usually but they go to the emergency room for that. So our emergency rooms are filling up with people that don't necessarily need to be there. It's not an emergency. And emergency rooms are for emergencies. Those people are really going to try to fix something that's wrong and get you back out or into the hospital. They don't have the time, and sometimes even the expertise to be looking at a whole plan for diabetes care. That takes time and follow-up.
Our little walk-in clinics, we have several here, and they're wonderful. If they had insurance, of course they want them to have insurance to treat them, and if they don't have insurance, as you say, they wind up in the emergency room just for anything. And something I wanted to mention about the working requirement and the people that sort of look down upon people, all they'll be working, is I deal with older people that have worked all their lives, and they're in their late 50s, maybe early 60s, maybe even drawing their Social Security at 62, but not able to work, or maybe not able to work full time, and just to take the attitude that all these people are just taking advantage of the system, that's just wrong. I can't think of, when in doubt, go to Matthew 25. When Jesus referred to the poor, the least of these, he didn't qualify it, saying now if they didn't work or if they don't deserve it, that don't matter. Just anybody that comes into the category of the least of these, we ought to do all we can do as long as we're able to help.
Mm-hmm.
And I'm as passionate about this, or more so, than when I went to that first January 2013 meeting that Donna Seeley had.
Yeah.
And it just is. I also see, the effects on people that don't have insurance and how much it means to them. And I love it when they call me up and say, Miss Nancy, I got my Medicare card, my Medicaid card, or I got my Blue Cross Blue Shield card, And so we'll just keep at it. That's regardless of what the opposition out there and the attacks. We'll just keep at it.
Well, and too, Nancy, I'm not saying that there isn't some fraud and abuse. There's fraud and abuse.
Oh, there is, yes.
At all levels of from food stamps to able-bodied Medicaid, and all the way up to the highest levels of government.
Of course. It's not perfect. I'll be the first to admit, but on some things, we're not in a position to judge.
That's right. Yeah, that's a big thing too. If you were a judge on the bench, it would be your job to judge. But I'm not going to judge somebody that's talking to me needing insurance. Oh well, you're really able to be out here working. I'm not going to get you signed up. No, I'm going to do what I can do to help, because it helps not only them, but society as a whole. Maybe they need help for an addiction. Maybe they need some mental health help that would help keep them from going out and doing something terrible sometime. I'm going to do all I can to help people get insurance. As a healthcare provider too, it's pretty hard to get that disability. I would have some of my cancer patients that had completed treatment